Okay, so the skill we're going to learn today is putting a patient in a sitting position and draping them. So the first thing that you want to do is wash your hands for about 30 seconds before seeing the patient, and then you want to introduce yourself. So, hello, my name's Emily. I'll be your physical therapist today.
Nice to meet you.
And what's your name?
Katie.
And your date of birth?
1/17/91.
Let me just check to make sure. Okay. So the first thing that you want to look at when a patient's in a sitting position is if they have good lumbar support, and if they don't, then you can place a pillow behind their back. Also, if you don't have a pillow, you can use straps, anything that will give them better lumbar support. Then you also want to make sure that they have good upper extremity support. So you can use the chair's armrests, or also use some pillows to put in their lap so they can place their arms down. You also want to make sure that the lower extremity is supported. So as you can see, Katie's feet are supported on the ground. Also, if the patient's feet don't touch the ground, you can use a footstool, or if they're in a wheelchair, you can use the footrests. So some precautions that you should be aware about when placing a patient in a sitting position is the pressure sites. So some of the common pressure sites for a patient when sitting is the posterior thigh, the ischial tuberosities, the sacrum, the medial epicondyle, and the olecranon process. So you want to be aware of this and tell the patient that they should move about every 10 to 15 minutes. They can do this by leaning from side to side, or doing what they call wheelchair push-ups, where you push up from the sides of the chair. So also some common contracture sites are the hip and knee flexors, the hip adductors and internal rotators, and the shoulder adductors, extensors, and internal rotators. You want to make sure that you check the pressure sites and contracture sites both before and after sitting. Next, we'll show you how to drape from a sitting position. So the first thing that you want to do is wash your hands for 30 seconds. And then you want to introduce yourself to the patient. Hello, my name is Emily. I'll be your physical therapist.
Nice to meet you.
And what's your name?
Katie.
And your date of birth?
1/17/91.
Okay, let me check just to make sure. Okay. So when draping the patient, you want to get a clean draping material. And when placing the drape over the patient, you want to cover all areas of the body except for the area that's going to be examined. For example, if she's getting some kind of test on her shoulder, this will be the only area exposed. All around. Okay. And you want to make sure the patient feels comfortable. You want to make sure they have privacy. There's not a lot of people walking in and out of the room. So you want to make sure they feel comfortable. And then the procedure can be done. And after it's done, you also want to make sure that you dispose of the drape into the proper receptacle. And that is how to properly place a patient in a sitting position and drape them.